Hey, this is a quick video out to my nurses. We've been doing a kind of a quality assessment thing at work, and one of the things that we were doing was looking at responses from our patients, and literally we talked to all of our patients. We're a small enough hospital that we talked to all of our post-op patients within 24 to 48 hours after their procedure. And this lovely young woman is taking it on, and she's been writing down all of the responses that we get from the patients. So she put them out in an email for all of us to read. I was interested in the fact that she highlighted with yellow, bright highlight in the email, all the negative stuff. It really triggered me in a way. I thought, first of all, why do you want to highlight the bad stuff? Or not even the bad stuff, let's say the not so great stuff, rather than highlight the good stuff. And then I thought, well, why would you highlight anything at all? I think that we're mature enough to be able to read the information and know what we have to learn from it. And I could be wrong. I mean, I'm an old nurse. It was somewhat distressing to me because, one, I got triggered by it and I didn't want to be unkind to her about it. I was triggered because it made me think about when I was in high school and I would get a C and I'd be put on restrictions. Even though I had 3 A's, if I made a C, I would be punished for that. And as all of you know, that as a nurse, there's a lot of critiquing and you get these heavy-duty evaluations, or at least we used to in the old days. And what they would focus on wasn't on all the good work you did, but what were the things that you didn't do good on. And I don't mean like here's areas of improvement, but these are bad things, and we're not going to talk about the good things. So I responded. I just asked her, what was the purpose of really having to identify the things in bright highlighted text, what patients said about their experience, especially because 99.9% of the responses are absolutely 100% great. And the ones that weren't were things that really you could look at it and say, what was the situation? Does it mean we weren't doing the best that we could, which pretty much we do. We have a really small unit, so we really work hard to make our patients feel good. And if you walked out into the community and asked anybody, they would say, oh my gosh, you get great care there. So I wondered, is this something that's just continuing to perpetuate itself in nursing? Do nurses look for the not so good in other nurses? Do administration still try to find our faults as opposed to nurturing our grace and the good work we do and the long hours and so on? Anyway, if you like this video, comment below, like it or subscribe, and let me know what your thoughts are about it, because I am curious how today we improve by patient response. What's the expectation when a patient says they did not have a 100% great experience? And do you like it pointed out for you? Or would you rather just kind of process it yourself and look at your own values and your own practices and choose to be better or not? Thank you very much. Comment below.